Heart failure, it's a syndrome, so it gives you particular symptoms. You get breathless, you get tired, you get swollen ankles, and it's due to the fact that the heart just can't pump enough blood around the body, either at rest or when it's doing things. So that's what gives you heart failure.
It's very common. Overall, it depends on the age of the patients that we're looking at, but overall its prevalence in the UK is anywhere between 1 to 2% of the population. Now, at the end of the day, all heart failure is due to the heart failing as a pump, but it can really fail in two ways. One is where the left ventricle, which is the main pumping chamber of the heart, does not pump properly, and its actual force of contraction of pumping is reduced, and that's called left ventricular systolic dysfunction. And that accounts for about 70% of all heart failure in this part of the world. The other type of heart failure is where the heart does not relax properly. It's usually stiff or hypertrophied as a result of years of high blood pressure, and when the heart does not relax properly, it does not fill properly, and if it does not fill properly, it does not empty properly. And that accounts for about 30% of the heart failure that we see.
So you have heart failure with a weak heart. That's where you have a reduced ejection fraction, and that's called heart failure with reduced ejection fraction. So normal heart pumps out about sort of 50 or 60% of its blood in one beat. And with this condition, it'll be pumping out less than 40% of its blood in one beat. So the heart will be bigger and weaker. And then an equal number of people have something called heart failure with preserved ejection fraction. And that's where the heart still can't pump enough blood around, but it's because the heart's stiff rather than it's big and weak. And I think that's quite important because the treatments for those two conditions are very different, actually. Most of heart failure, most of the time you're talking about a problem with the left ventricle. Now sometimes you can get weakness in the right ventricle, the right pumping chamber, that pumps the blood to the lungs. And you often see that in people sometimes where they have bad lung disease and the pressures in the artery to the lungs get raised and the right side of the heart then struggles with that. So you can have a condition where the right side is weak due to lung problems, clots on the lungs, occasionally again due to inherited heart problems.
And it's very important to understand all of these different types once you have your diagnosis, because the treatment's slightly different, but the symptoms are not. But the important thing is that once that echo scan tells a doctor what's wrong with you, you can start on a good treatment plan.
The progression of heart failure is quite unpredictable. However, it is usually the case that there will be a slow but steady progression in the disease, and then as that happens you might on top of that have episodes where you have acute heart failure that will admit you to hospital.
Everyone is very different, no two cases are the same, but we do know that generally over time the condition does get worse, but that can be a long period of time over many years.
Obviously when you first present with heart failure, the quicker you're diagnosed, the sooner you're put on the appropriate therapies and see a specialist usually, then that is going to impact probably on the trajectory of your condition.
So a lot of patients with heart failure live for a long time. Their symptoms improve with the medical therapy we give them. So it's a very variable disease and it's a very treatable disease. So I would say for a lot of people with heart failure, actually the outlook is good these days.